Welcome everyone. My name is Karen and I'm an outreach liaison for AspenRidge Recovery. And for those of you that are not familiar with AspenRidge, we provide dual diagnosis drug and alcohol treatment. We have 4 physical locations in Colorado, and plus the virtual intensive outpatient option through our REACH program. I will type in some information for all of you in the chat box so that you can reach out to me if you have any questions regarding our programs. And today we have our wonderful Jill Pop, who is a primary therapist for our Fort Collins location. She's a primary therapist for our PHP and IOP programs, and she will be presenting a webinar today on art therapy in the treatment of co-occurring disorders. So without further ado, Jill, you can take it over.
All right, thanks, Karen. Welcome, everyone. I'm thankful that you're here today. So hopefully, I know my screen says Jennifer. She's our front desk lady, and I'm using her computer. Jill Pop, and I am a licensed addictions counselor, licensed professional counselor, acupuncture detoxification specialist. That is the ear acupuncture. A registered yoga teacher and an art therapist. I've been a therapist about 7 years. I first went to art school and then did a lot of psychology and did my master's in art therapy and counseling. And that program was really research-based. It was in a medical school, and so I like that background as well, and the why behind the art therapy and the research behind the art therapy. So I want to tell you a little bit about the profession and who is an art therapist and how that might work. Also give you some examples of what we've done in our PHP and IOP programs. And Karen, I don't think you said this, that you can submit questions in the comment box, and then Karen will let me know if there was a question, or I might be able to see that also. The phone connection, it looks like we have one person on there with the audio separate, and so hopefully that's working. And the presentation will be recorded. I can send you the presentation afterwards, but it will not include the client artwork. If you have any questions during the presentation, let me know, but I'll have some time at the end as well. All of the clients have given signed consent for their artwork to be shared in education and marketing purposes. So anything you see on here, we have paperwork for that. And I'm going to read this art therapy definition because it's exactly what they have on the art therapy website. The American Art Therapy Association, if you want to learn more about that, it's that arttherapy.org. Art therapy is an integrative mental health and human services profession. It's used with individuals, families, and communities, and it includes active art making, creative process, and psychological theory, with the human experience of the therapeutic relationship. And it is facilitated by professional art therapists, and we use it to meet our treatment plan goals, just the same as we do with our talk therapy. Art therapy, you do have to be a master's level clinician. Because of all of these things listed under there, it is a 2 or 3 year program. Mine had the counseling as well, so that I could get that licensed professional counselor and then do the additional addictions counseling on top of that. So it's very big and it's very in-depth and research-based, and that's why it's important that you have the education if you're going to use art therapy. There's risks if you were to use it without the background, triggering people in some way, or reading the artwork inaccurately, different things like that. So that third one on there, the assessment and evaluation, I can do a biopsychosocial assessment using art, and I can get a diagnosis between the art and the explanation, the verbal explanation that the client is giving me, as well as observation of their behaviors. I can align that with a diagnosis and create a treatment plan around that. It's really interesting. Something I've seen with addictions is a man who was about 68 and a long-term alcoholic. His artwork looks the same as a 6-year-old with ADHD. And that's because the brain disorganization is that bad when you've used alcohol for that long. So, but I can obviously tell that I have a 68-year-old man or a 6-year-old with ADD sitting in front of me. But it's very interesting. Things that come up in their artwork that can indicate trauma, we can see auditory hallucinations come up in artwork. We can see depression, anxiety come up in artwork based on the color scheme or the application of the lines. And it can be used in individual or group therapy, as well as couples counseling and family counseling. The experience with couples counseling that I've had was to help the family understand what the individual is going through. So the art may be able to show the family something that they're not able to say in words. And that could be having a brain injury. If you were to draw a clock, somebody with a significant brain injury could not get the organization of the clock. But that could show, if I have somebody that all their numbers are on the top right of the clock and they know that's wrong, but because of their TBI, they can't figure out how to fix it. That shows a lot to the family about how their brain is functioning. And maybe like they could make a cake, but they can't get all the steps together to make a cake. And it alleviates some of the frustration of the family to actually see that this is real and significant. It's very sensitive to multicultural issues. There's a lot of multicultural training in the art therapy programs because we would use different materials with different cultures. Requires a lot of internship experience, a lot of supervision. And art therapy lets us provide healing to the mind, body, and spirit in a way that verbal language doesn't. So verbal language can have a lot of limitations. And so visual or symbolic or art making can sometimes surpass those limitations of the language. So giving things, expressing things that we don't have words for. If you were to ask somebody to describe what it's, if you were going to ask a veteran to describe what it's like to live in his body, that would be a really difficult thing to explain in words. So this picture on the right is a veteran's drawing of what it's like to live in his body. So it was a really powerful illustration for him to show other people what it feels like. And it was something he was able to use when he talked to his family to help them understand what his experience was as well. These were some other ones. The left one is bipolar, and they were talking about the kind of the manic episodes and then the juxtaposition of the depression and how it's like so intermingled, and even the like good parts of the mania where they feel really productive and really energized can be not helpful, and then they can switch to depression just as quickly as it came on to mania. The one on the right is major depressive disorder. That was the client's diagnosis, and just really feeling like hope was out of reach. and being able to use that artwork to talk about how she was experiencing her major depressive disorder in a way that maybe she couldn't have done with words. This is somebody's addiction and how they were out of control in their life. And the addiction was running the show. The addiction was what had control. So kind of this like spinning vortex type of thing, that 10 years with the dragon head, she had been struggling with addiction for 10 years. And it really, really impacted her life and her self-esteem. A lot of those words with loss and disruption of sleep and the mental health struggles behind it. And then trying to get out, and it just kept repeating the same cycle over and over. After she completed this one, she created a vision board. So this kind of put her in a pretty negative headspace where she felt like the addiction was winning. And so actually on her own, she created a vision board of what she would like her future to look like. These are some of the recovery skills that we're addressing in individual and group art therapy. And DBT is a big thing in Northern Colorado, so I put those up there. The mindfulness, distress tolerance. Distress tolerance is like frustration tolerance when you don't have control over things. What can you do about it? Emotional regulation and interpersonal effectiveness is how we communicate with others and get our needs met effectively. Other recovery skills might be impulse control, problem solving, delayed gratification. That's a big one. People struggle with that a lot. Tolerating imperfection. That has a lot to do with your personality, if you can tolerate that. Meaning making, frustration tolerance, trauma integration. So when we talk about other trauma integration therapies like EMDR, we're trying to integrate the trauma into our life story. And a lot of the times that has bilateral stimulation, the right and the left brain. So there are art processes that we can do that also help that connection of the right and left brain, and also give us the distance from the trauma in order to put it in our past. And I'll talk more about that later. Identity formation, a lot of addiction people lose their identity, or they don't know what their identity is without the substance. And in PHP especially, people are working on that, who they are and what their future looks like without the substance in their life. A lot of times they're cutting out family members or friends or things that are part of their using and trying to rebuild the identity. Building self-esteem, even really just success-oriented type of art can be helpful when people's depression is really strong, and we can build that self-efficacy and self-esteem. Safe emotional expression, grounding, getting ourselves in our body and in the moment, self-reflection, and self-soothing. So on the right-hand side, this is a Zen tangle, and it was developed by a calligrapher and a monk. And it's a meditative art process. So with this, they would be using the impulse control to be able to make the patterns. They would be using grounding because they're in the moment and in their body. If they weren't, they wouldn't be able to do the art process. Probably tolerating imperfection. So this could be something that's very soothing for people. And on the opposite side, it could be very frustrating for people, depending on their personality and their organization in their brain at the time. We see the organization in their brain getting better and better the longer that they're sober. So this could be really scratchy and disorganized on their first week, but then they can get more and more and more organization as their brain gets more organized. The AspenRidge PHP art therapy group is called Creative Recovery, and these are some of the topics that we might do in that group. Meaning making with Dear Addiction, that has to do with slam poetry, and they write their own slam poetry. Mindfulness, a stop skill, which is a CBT skill, and creating a body map. I'll show you some examples of that later. The science of meditation with the Zentangles that I showed you in the last slide. Grief and loss, and that could be done with a lot of different art processes, but in groups, most often I use origami to make a tangible representation of the person that they lost. And sometimes we might do mindfulness and walking in the flower gardens. We might talk about childhood trauma and combine that with art interventions, maybe safe place or bilateral coloring, which will make that brain stimulation. But the same as we use safe place in other trauma treatment, this would use safe place as a visualization, but then also maybe creating it with art, or maybe in a box or with images. Journaling, DBT, self-soothing with therapy putty. Art therapy can be very serious, or it can be making putty. So depending on what the headspace of the clients are that day. Somebody's book page art. So we blocked out everything on a book page except for words that they wanted to keep. And this was really important for her because she is working on self-love and self-esteem. And she made this about that. Dreams are for any age. I deserve the truth, to take time for myself, to laugh as much as I want, to not know, to be unsure or uncertain. I don't deserve to be attacked for who I am. I deserve to change my beliefs once I discover a better way. I hope I will allow space in my life to have this conversation way earlier. It's not selfish or arrogant. Life is a magical journey. So we can kind of see the transformation of her self-esteem here, and she's constantly working on that self-love, but she keeps this artwork around and reads it when she's in her negative headspaces or self-deprecating. One of those groups that I mentioned was mindfulness, stop, and body map. And I will usually play a meditation for people that will set us up for the body map. But it's important to talk about mindfulness and what that is and why it's important for relapse prevention. Mindfulness is being in the moment, being aware of what's going on inside of us, what's going on around us, doing one things at a time, being purposeful in what we're doing. And that's important in relapse prevention because we need enough time to respond rather than react. So it helps us slow down, notice the warning signs, notice what's going on in our body. Hey, I'm feeling angry, what's underneath the anger? And gives you time to identify what's going on and then have an appropriate response that's in alignment with your values, rather a reaction that might put you in relapse or damage a relationship or something like that. I put this quote from Viktor Frankl. He was a psychiatrist and a neurologist. Oh, he's going to correct me on that. And he was in concentration camps. So between the stimulus and the response, there is a space. In that space lies our freedom to choose our response. In our response lies growth and freedom. But if we don't have the space that he's talking about, then we're not able to choose our response. And I want to play this meditation for you all and have this experience so that we can then talk about the body maps and where the clients were going with that. So just uncross your legs if that's okay with you. Maybe close your eyes or find a place to focus on. And start to focus on your breathing. Maybe breathing in for 4, holding for 4, breathing out for 4, holding for 4. The holding your breath is letting the oxygen get to your brain and your other organs. When we breathe real short, shallow breaths, our brain's not getting enough oxygen, our heart rate ramps up, and the anxiety gets worse. This is just 4.5 minutes. It is on food cravings, but we're going to think of it in terms of substance use cravings. So if you're fine with your eyes closed.
One of the most powerful ways to handle a craving is simply to pay attention. The acronym STOP can help you do this. Right now, or as soon as you notice you have a craving, please call upon the acronym STOP, S-T-O-P. The letter S stands for simply that, stop. If you're in a place where you can do so, I invite you to sit in a comfortable, upright position and gently close your eyes. If you can't sit and close your eyes, still stop your action and take a moment for this meditation. The letter T stands for take 3 deep breaths. Go ahead and do it now. Please take 3 full breaths, allowing the air to first fill your abdomen and then your chest. As you exhale, allow your chest and finally your belly to fall. The letter O stands for observe. First, I invite you to observe the sensations in your body. What are the most prominent sensations in your body right now? Where do you notice your craving on a physical level? Our cravings are actually comprised of bodily sensations. See if you can contact and actually notice and become aware of those sensations now. Next, please observe your feelings. What emotions are you feeling right now? Oftentimes, cravings have emotions underneath them. See if you can feel these emotions. Where are they located in your body? Are you energized or sluggish? Perhaps anxious, nervous, or overwhelmed? Sad or excited? Often we experience a mix of emotions at any given time. What emotions are present for you right now? Are they static or is there some movement? Now I invite you to observe your thinking. What thoughts are going through your head right now? What is your craving telling you? What do you imagine will happen if you act on your craving? What do you think you'll feel and think after you've acted upon it? What do you think will happen if you decide not to act upon your craving? What emotions and thoughts will you have in that scenario? Next, please observe the current situation. Where are you? Whom are you with? What are your urges in this moment? What options are available to you in this situation? How would you wish to act in such a scenario? And finally, the letter P stands for proceed. Proceed in a way that supports you and those around you. Taking one more deep breath, please evaluate the next step that supports you, your long-term goals, and those around you. Then, with this in mind, I invite you to proceed with as little judgment as possible.
Amanda, if you want to write this down, this is a cool group exercise, and to talk about it, Dear Addiction by Kurt Schroeder. It's on YouTube. And that's not so art therapy that another therapist couldn't do it and then have them write their own addiction, their own Dear Addiction. Let me go back over here. So I have that STOP. That's something that they can do without having that actual guided thing. And the biggest part of it is that, observing thoughts, emotions, sensations, surroundings. So I have this body map over here. The directions that I gave them were to depict their body sensations and their emotions inside the body. So body sensations could be like butterflies in my stomach, or burning in my fists, or heat in my face, things like that. Emotions could be anxiety, anger, depression, but the emotion of anxiety might show up in your body as like stomach aches, or as feeling like you can't breathe. On the outside of the picture, they're supposed to show surroundings, people, places, things that cause the cravings, maybe the time of day, things like that. And they drew a thought bubble with thoughts that they're having when they're having a craving, or when they're having thoughts of using. And the most common one of that is when you get the fuck it's. That's usually one of the big thoughts that people identify. Here's two examples from groups, and we can see the red spot on both of the bodies there, and that is because of alcohol impacting people's livers so much. A lot of people end up in the hospital for liver damage before they come to us. And so that was something that both of those people indicated, and many other people have indicated as well. On the left, he had really, really strong faith and a connection with God, but his alcohol got in the way of that connection with God. There was a lot of anger with God because of his addiction. So that was a trigger, and also something that he had to do a lot of healing around. Feeling loneliness, emptiness, frustration, not knowing what's next, or not knowing that that was an important thing for him, and something that he processed in individual therapy. And finding out after the fact, I don't know what that was, but he did have a big story about it. So different ways of showing hopelessness. This guy had it with the chains that are on his wrist and his hands. And just feeling like not having a voice, that one that's around his neck, talking about not having a voice. but also the heart with the slash through it, not able to show his feelings, or not being, as a man, not being able to have emotions. He talked about that as well. Up on the other one, it's my favorite thing. This is a hamster wheel in his brain. And he talked about like ruminating thoughts, leading to anxiety, leading to wanting to use. And that was a huge struggle for him and something that he worked on. The work liquor store home, it's interesting to note how small the home is. If we were thinking, like, a lot of times size will represent importance. And it was like he almost totally forgot the home when in there. Pain is a big part of addiction. There's some knives in his knees, and that was something that he indicated as pain. On the left, one of his major treatment plan problem areas is anger. And we can see that in his artwork as well, and how anxiety and anger were very connected for him. And that also came from feeling confused or out of control, feeling that things weren't fair, talking about people who can drink and not have an addiction compared to his inability to stop when he started drinking. You're doing this to hurt me. He had some anger at family for pushing him into treatment. And that's common. That's common here. We can see the pain again on the right-hand side one. There's little orange all the way around the entire body, and all of those little words say pain. Pain was a big reason for his substance use. And he had to work on a lot of pain management. And getting off the opiates did help his pain in the long run, but it was uncomfortable. Pathetic, be better. So those negative things that other people have told him, and then we start to own those, and they start to get bigger, and we start to believe them about ourselves. I'm on a lecture. I'm sorry. I'll be out at 1. Oh, I'm using the office of our med provider. Another group that we might do is a grief and loss group. And this is because grief and loss is really big and abstract, and we need to make it more concrete and be able to put language to it. So I'll start that group with that loss cycle and talking about the process of loss, and then recovering from loss, and how we can repeat that cycle over and over as well. The clients will talk about their experiences of loss and where they are in the cycle and how that kind of played out for them. It would be followed by a TED Talk that's about moving forward with loss rather than moving on from loss. And in groups, we often do the paper cranes. The paper cranes have a background of loss too. In the bombing of Hiroshima, there was a little girl who had leukemia, and she believed that if you made 1,000 cranes, you could be granted a wish. And she wished for world peace. And that's how that origami became called the peace cranes. So I would have the group members write something about their person that they lost on the inside of the origami paper. And it might just be like a favorite memory or describing words for that person. And then we would fold it up into this bird. And so and that's at the end of the group. So it also kind of has this like wrapping things back up action, because we just kind of like like emptied out a lot of stuff, and it could be really emotional and people could be pretty upset. But origami has little emotional impact, and the folding of it helps them wrap that back up before we leave the group. It also creates like a tangible representation of their person that was lost, and that's meaningful for people. Another thing that we've done is memory pillows using the clothing of the person that passed away and making it something that you can really like hold, and it's comforting. These were other grief and loss pictures, using collage in those top two to work on grief and loss. A lot of people will do some kind of box project with me. If they lost someone, maybe they create a memory box with some pictures of them or some collage images from a magazine, and then writing letters and putting the letters in that box. The box kind of gives them a way to like a container. Or other people maybe losing a baby. That's been important for them as well. This is the lighter side of art therapy, and we did a mindful walk and walked to the sculpture gardens that are really close to our office here in Fort Collins. That picture on the top right, the cartoon, it just shows like what mindful means. So we're sort of like sorting through all the junk, and we're just in the moment on the walk, and not the woulda, coulda, shouldas, and not the anxiety thinking and the anxiety tornado that's on that left side. So when we do this walk to the flower gardens, I instruct them to pay attention to the 5 senses to stay in your body, or to pick a color and notice everything of that color as you're walking, or to count your steps as you're walking, things that help you stay grounded and in your body and give your brain a break. And these are clients who are painting in the flower gardens. We just kind of took a bunch of art materials with us. During COVID, we did paper making, and this is at the Women's House. This process was primarily for distress tolerance, which is a DBT skill. And we started with brain dump journaling, which is like everything that's in your head and in your heart, kind of like word vomited onto a page. It doesn't have to be beautiful. It doesn't have to sound good. It's just like getting it out and giving us distance from whatever it is that's weighing us down. Literal distance and ability to reflect. Also, journaling is bilateral brain stimulation when it's handwritten, not when it's typed. So it would balance your brain about something that you were emotional about. We tore that up, and then we did the paper making with it. That involves using a blender to make the pulp, and then using these screens and frames to strain the water out. And it was really interesting, people's personalities coming out in this. Some people really liked the just tearing the magazines out, kind of like cathartic, just like ripping things up was calming for them, and other people it was distressing for them. This part of it where it's actually like sloppy and wet, some people liked it and some people thought it was gross. The sound of the blender might bother someone. So there's a lot of opportunities to work on frustration tolerance or distress tolerance. If you drop your thing, or if you make a wrinkle or whatever. So mindfulness, interpersonal effectiveness, this really, they all were in the kitchen together, and it was a giant thing and a giant mess. And so they really had to communicate with each other and regulate their emotions and control their body too. You have to be pretty calm when you're doing this. Self-soothing, working as a team, asking for help, communication, delayed gratification. This is a very long process, and then it's wet for like 72 hours. So then they have to do the waiting to actually use the paper. Impulse control, following directions. There's a lot of implications for art therapy and trauma treatment. And that's because when we really want balanced functioning of the right and the left side of the brain. But in trauma, your left side of your brain shuts down. That's the verbal and the thinking part of the brain. And also the organization and sequencing and time are all on the left side of the brain. And at the same time, the right side is what's overactive. And that's the creativity and the images and things like that. So when the verbal side of our brain is what is dominant during the trauma, that's why we have flashbacks and nightmares are visual. And it makes it difficult to access trauma verbally because the verbal centers of your brain were shut down. So art allows us to access trauma in the visual side of their brain, which was what was online. It also helps with pre-verbal memories, little kids that don't have the language for what they experienced. Art can help them access it as well. There's an approach for trauma treatment using art. It's called intensive trauma resolution. It was created by a psychiatrist and an art therapist. And it's a way to use art to give traumatic memories order and verbal coding, historical context, and you're viewing it from a third person view. So you're not reliving the experience, you're drawing it as you when you were 20 or as you when you were 10, and then you're narrating it. There's different therapies that use graphic narrative, but this way we are narrating what happened with the images and talking about fight, flight, or freeze. But by being able to give it the verbal coding, we're able to move it into the left side of our brain, process it in the left side of our brain, and move it into the past, because our trauma side of our brain doesn't know time. The corpus callosum, it's what's connecting the right and left side of the brain, and it enables communication between the two. But if we have the whole left side shut down, then there isn't good communication. But art lets us bypass the corpus callosum and access the trauma and then move it to the other side of the brain. I hope that makes sense. Even trauma could be that bilateral stimulation as they're talking about something. There's a lot of different ways that art could be used with trauma. This is somebody's artwork of their domestic violence. That's another thing that's really hard to put in words. So on the left side, she was, this is about safety, not feeling safe, being watched, being threatened. And that's how she chose to show what her experience was with being a victim of domestic violence. And then with that, we were then able to look at something more concrete and have a discussion about it. One way of doing that is using the DOS power and control wheel. And this is to give language to domestic violence and to hopefully validate what their experience was. This is really heavy. This whole conversation was really heavy. So then the next piece of it was making a relationships vision board and talking about the equality wheel. That's the opposite of this power and control wheel. So we do want to like not just leave people in pain and raw. We want to find ways to wrap it back up or refocus them. And that's all I have for you. My number isn't on here. That is my email. And we can look up the number too. But I'm happy to answer emails, to answer phone calls, and any questions you have right now.
Thank you so much, Jill. Yeah, if you guys have any questions, feel free to just ask verbally, or you can type it in the chat box. And if you want, we can send you a recording of the video as well. All right. Well, if no one has any further questions, like Jill said, feel free to email her or myself. And thank you all so much for attending this webinar. Jill, this was amazing, eye-opening. Oh, we have something from Amanda. Okay. Yep, I will be sending a recording of the video, except the slides can be sent, but not including the artwork that Jill has from, she got those from clients, and so we cannot share those, but we can share any other information on the webinar. Yeah, Jill, thank you so much. This was amazing. I really enjoyed this webinar, and thank you all for attending, and I hope you all have a great day.
Thank you, Karen.
Take care.
Thank you, everyone.